right, Skin and Bones back from a long hiatus. It's nice to see Zach's beautiful orthopedic bone structure today. Looking good as usual, Zach. This is episode number 11 of the Skin and Bones podcast. It's been quite some time, but we're happy to be here on May the 1st, 2022. And it's a good day to be alive, Zach.
It's always a great day to be alive. It's been a while. Life's happened, and we've kept contact, but like even getting an hour just to sit down and do this has been, I feel like just the end of this year is just so crazy and a lot of new experiences. And now it's like getting caught up in what the next step is and going forth with that. So yeah, man, it's good to actually sit down and chat with you and talk about some things.
Yeah, for sure. You've been working on all your medical licensing, getting ready for the move to Georgia and getting ready for your fellowship. So that's been taking up your time. You've been busy with your rotations. I've done a few things since the last time we've gotten on this podcast. Got a chance to go to our national meeting, our national dermatology meeting in Boston. First time out there. Really cool city. Really cool city. It was awesome seeing all the history out there.
Out in
Cynthia,
Boston.
out in Boston.
Go get some chat out in Boston.
Yeah.
Have a pack of Menthols.
Yeah, it's so funny because I mean, the stereotype that I had in my head of people from Boston was more like New York, kind of like a little bit angsty and loud. I mean, they're loud, but they're super polite. They're like a lot more polite than I thought they were going to be for a bunch of Italians and a bunch of Irish people trying to get along in a city. So I mean, they were super polite.
That's so judgmental of you, Peter.
I think it is
judgmental of you.
I think it is. I mean, even as doctors, like we battle our stereotypes too.
Yeah, it's like when you go to the Midwestern places and you're like, I'm from California. You're like, oh, you don't seem like a Californian to me.
Wait a second. Stereotypes aren't always true. Is that what you're saying, Zach? Oh,
interesting.
My goodness, we have to fight against them sometimes and actually realize that it's not the way
we have to have conversations with people. Yeah, we do.
Yeah, it's great. I love it. But we had a great time out there. Yeah, a lot of people we met even in the service industries, like riding around in Ubers, people waiting on us at restaurants. Super polite, super awesome people. And Cynthia brought it up first, and I agree with her. There are some great people out there in Boston.
Yeah. What do you think what's one thing that surprised you about your national conference being there for the first time? And what's one thing you really took away? What do you like look forward to going back and doing?
So one thing that surprised me. So one thing that is weird is that I actually went through residency without ever going to our dermatology national conference. So a lot of times
COVID kind of got in the way of that too.
It did. So I mean, I got a couple of them got canceled because of COVID. Your first year of residency, you're usually covering call at the hospital and you get the short end of the stick. So I mean, that's just kind of the way it goes. But then it's awesome to go to all the sessions, plan out what I wanted to learn more about, figure out what I was going to anticipate and including into my practice that I felt like I could use some brushing up on and things like that. It was a great experience. And then seeing 10, 15,000 people who are in your same field or have some sort of connection to the realm of dermatology. It was surprising how well run it was. Having never gone to the conference, it was just like a well-oiled machine. I guess I shouldn't be surprised. Usually dermatologists and people who are in dermatology are pretty type A. But it was very well run. One thing that I'm definitely looking forward to, or one thing that I took home from it was in my practice, a lot of the scarring types of alopecia. I had some great lectures by some opinion leaders in that realm. And I felt like I had a lot to learn in that area. And I'm already applying some of the stuff that I found awesome. Out at the conference in multiple patients so far. And what's cool about that gets me a little bit hype is that I tell the patients that I'm continuing to learn and that I just learned this at a conference I went to. And I think people appreciate that. I think you kind of come down to a human level. Obviously we have a lot of knowledge. We have a lot of experience in our fields, but just being able to talk to the patient one-on-one and say, hey, I just picked this up and this is the newest advancements. And I'm continuing to keep my ear to the ground to see if there's any new treatments for this difficult disease that I'm here battling with you. And it's really
Cool.
cool. Yeah, so that was one thing. I'm looking forward to finding more. I wouldn't say weaknesses or things. I would say things that I am looking forward to improving on,
Yeah,
without necessarily thinking it's a weakness, but just showing me that, hey, there's new advancements here, and that's the best way to do it. And networking with people who are just brilliant was just a fun time. Seeing old colleagues, seeing mentors who helped me get to where I am today. It's just a
cool.
really awesome opportunity. I don't know if I answered all your questions.
No, I think you did. And for people who don't know, or maybe who are in medical school, you know, your national conference in your respective field is, it's a really interesting and fun experience, where, like Peter said, like you have, you know, there's multiple rooms with lectures, so you can pick and choose what you want to do. I want to learn about this. I want to learn about that. You know, for Peter, alopecia was one of them. Probably dealing with drug-induced inflammatory rashes might be another one, something like
Hmm.
that. In
Yeah.
my field, it's sports medicine, biologics, spine, trauma, and so you can just pick and choose. And you know, like you said, there's some big names. Everyone knows the big names in academics, and so usually when you go to their lectures, if they're giving a lecture, it's pretty packed. And some of them you actually have to pay to go to the lectures, which is pretty
Yep.
wild.
Yeah.
And then there's a showroom of everything that is being distributed in your field. And
Hmm.
so, you know, think of it as if you watch like you know, gear, or speed, the speed channel, I think, for cars, and you know, they have those car showrooms. That's exactly what it's like, but
Hmm.
without cars. It's implants, it's injections, it's medications, it's place where you can go and you can look around and just be informed. So yeah, it's
Yeah.
fun. Like mine was in the one we just had one in Chicago. I didn't go to,
Hmm.
but we had one in San Diego, which is a lot of fun. You see your colleagues, but it's a great learning experience where you can learn what is the newest things out there. You can learn
Yeah.
from people who are very respected in their fields.
Yeah.
And like you said, you're constantly growing because there's so much literature that's out there now. It's really hard to catch up. But when you go and sit down and like listen to someone, you actually and you get time to actually ask questions if you want to. And
Yeah.
so I think it's really a place for, and it's like you speak a different language, right? It's kind
Hmm.
of cool because how you speak to someone is completely different than, I mean, if I were to go and talk to someone about something using abbreviations and things like that, you'd be
Yeah.
like completely lost. And
Yeah.
if I went with you and you said something, I would be completely lost. And so
Hmm.
it's a really cool area where you just gather with like minds and kind of nerd out. So yeah, it's really fun.
Yeah. It is fun, and especially in dermatology, everyone, those showrooms of all the new products that they're coming out with for anti-aging, you name it, like Botox, fillers, moisturizers, all the big companies are out there. All the EMR specific for dermatology practice, the laser devices, the new facial devices. So it's a lot of tech and pharmaceuticals that come into play. But really, fundamentally, it should be about learning more, and making sure that you're interacting with your cohort of people who have learned the same things as you, but are still looking to expand their knowledge base and get better at their craft. And it's just a really great experience, and it gives you the opportunity to go to a new city, and then
Yeah.
actually meet new people you haven't met before. So I
Yeah.
thought that
And
was great.
you get to bring your spouse, and
Hmm.
she had a lot of fun too. I know Cynthia
Yeah.
had fun. And yeah, I mean, and some of it, granted, is personal fun. You get to go to a new city, you get to go out
Yeah.
and try different food, and
Sure.
go out and have fun and catch up. And it's a great experience. So it's something that definitely
Yeah.
I don't think I really took advantage of while I was in residency, but looking
Yeah.
forward to doing it once I'm done.
I think you going into medical school, you don't think that you're going to have like because any other type of field you work in, they have trade shows. It's basically like a big trade show where you're just trying to learn as much as you can. And going into medicine, you don't think that you're going to benefit necessarily a lot from that, but there's a lot of positives to going to these conferences, and there's all sorts of
Totally.
conferences. But
Totally.
it's pretty cool. Yeah.
That's awesome, man. Yeah. You know, for me, I just got done with my elective, which is 4 weeks of doing, you know, something that you get to choose. You have to apply to it. And with COVID, it was a little hard because I was looking at a couple different areas, both internationally and locally, and in the States. And with, you know, when I was looking to apply for everything, because you have to apply for applications to be able to operate, to be able to be there. There's a lot of different, you know, you got to show like your PPD paper. There's paperwork you got to do anything, right? So
Yeah.
Omicron was big at that time. So a lot of places were like, no, you
Mhm.
can't. And so I reached out to one of our attendings here, and he's like, "Hey, I got a good friend who's in private orthopedics. It's a small group, but they're very busy, high volume."
Mhm.
And he gave me his number, and I reached out, and I'm so happy that I had this opportunity. It was a locally private based orthopedic practice here in Sacramento,
Yeah.
with two physicians. One is sports medicine and one's total joints, and they're both high volume, and they're both just amazing people. And I'm so happy I did that. And even, going internationally and personally, like having time off and going to wherever would be fun. But I learned so much about the business side of medicine.
Mhm.
I learned about how they approach their patients, because I feel like it's different from academic medicine too.
Mm.
And then how they build a business model. And those are things that you don't get taught in medical
Yeah.
school or in residency, because you're always in an academic center. Some places do have some private centers that they go to, dermatology, plastic surgery, things like that, that have more elective based surgeries. But for the
Mhm.
most part, you're at an academic setting. And so, the one thing is that is true is there is a financial side to medicine, and you
Yeah.
need to learn how to compensate for what you are worth. And
Sure.
so to have those discussions, I felt like I was like an infant and like I'm like, wait a minute, I'm about to be done like in this world. And they were just a world of knowledge, because they've both invested in surgical centers,
Mhm.
and talked about that side. And then, we were running two ORs and doing a lot of total joints, how to have physician assistants, because those physician assistants you're paying for. So
Mhm.
it's not like the hospital's paying it for them for you. It's out of your income. And so how to navigate that, how to best make it work for you.
Mhm.
um and not to mention just the amount of surgical knowledge that they gave me. And
Yeah.
I mean, I've probably made about 8 PowerPoints on just their little skills, tips, tricks, how they position, all these little things. And, it's just like you see that difference of thought process and how they do
Mm.
it and why. And, oh, hey, so and so does it this way at my institution, but you do it this way. Why? Well, I do it this
Yeah.
way because XYZ. It was just really a great experience. And like I said, there were just two amazing guys. And we were at this one hospital because they have private centers that they operate at.
Mhm.
Unfortunately, because it was such short notice, I could only watch them, but that was for a very small amount of time where I had
Yeah.
to go out there and just watch. But most of the time, I partook in the surgeries at this one hospital, and they didn't have a speaker system. So the scrub techs would bring in their little portable speakers, but then they'd leave halfway through the case and it'd be like dead quiet in there. And so I was like, this can't happen. So I
This
got him
doesn't
a
work.
really nice, yeah, I got him like a really nice JBL audio,
Uh-huh.
little, portable Bluetooth boombox that lasts 12 hours for them. And I got it like halfway through, and we were just, having a good, and they were just, such great guys. And it was worth
Nice.
it. Like for them to not know much about me and to trust me with their patients, and to allow me to operate and interact with their patients
Yeah.
is it was a really phenomenal experience. It was something that I will always cherish, definitely moving forward
Yeah.
at this point in my training. Like, definitely, I loved it.
Of course. Yeah, it's at any point in any residency in any specialty, you're going to have to come to that decision between choosing academic medicine, between choosing private practice, between choosing some form of the meld of the two in a multi-specialty group that may have some sort of academic affiliation but may not be directly at the academic hospital. There's all these
Yeah,
different
we'll
types
call
of
it hybrid,
places.
right? It's like a
Yeah.
hybrid. Yeah.
Yeah, there's all these different types of places that you can practice at with a lot of different subtleties in there. I chose to work at a great private practice. I work with great people, great colleagues to bounce ideas off of. And I consider myself really lucky for
Yeah,
that. But it is different, and you do see the business side of it, and there's absolutely a lack of education regarding
for
that,
sure.
and it's definitely expected when you come out to not be well polished in that. You're always going to be learning the financial side of things, and you do have to pay for the roof over
Yeah,
the clinic that you are seeing your patients in, and you can't necessarily negotiate really good reimbursement rates from insurance companies so that you can take more time to see your patients, so you don't have to pack your schedule so full, that sort of thing. So it's definitely a fine balance between making sure that you're having enough money to pay these great doctors, these great human beings who genuinely care about great patient care, and making sure that they're paid what they're worth, and then also having enough I guess wherewithal to say, hey, I mean, the financial aspect, you can't avoid it. It's just how are we going to make sure that it doesn't obstruct the good patient care aspect of things. I don't mean,
Right.
and
And not
it's a
only,
hard balance.
yeah.
It's incredibly hard, and I'm learning so much about it
Yeah.
every day.
And it's not only that, but the great medical assistants who spend time with your patients, get
Yeah.
vitals,
Yeah.
schedule everything for you.
Mm-hmm.
For the people who take the referrals who come in and put them on your schedule, like those, all those people need that money is coming from you and your
Yeah.
practice and how you output. And it's it's, I don't want to say it's weird, it's just not a part that we hear a lot, because you're so, in medical school you learn about medicine, you learn how to become a good doctor, then you go into
Mm-hmm.
your residency and you learn how to be a good surgeon or dermatologist, and knowledge, and then you get in the world and you're like, wait, I'm actually worth something. Okay, how do I maximize this? How do I, you know how do I know that my efforts, my job is actually being properly compensated? Because
Yeah.
there's a big thing, we want to be doctors to serve our community and all these things, and that is 100% true. That's at the groundwork of a lot of physicians. Can't say all, but a lot of physicians. But at the same time, it's like we have skills that we have dedicated our 20s and 30s to, basically sitting down and studying and not having a financially productive life, that we need to be compensated for, because there's not a lot of people who can make decisions to affect patients' lives like these.
Yeah.
And so it's a really interesting aspect. Whereas if you go to an academic center and you sign up and it's like, hey, this is your salary, you need
Mm-hmm.
to make this many RVUs, which is
Mm-hmm.
a reimbursement. But really it's like, hey, this is your salary. It doesn't matter if you do this many, it doesn't matter if you
Yeah.
do that many. This is what you're getting.
Yeah. And it
And
really
in the
depends
private
on where you
world,
work. Yeah.
yeah, and it's in the private world, it's like, hey man, like as much as you want to do, you can do, but if you're not doing a lot, you're not
Yeah.
being productive. And it's not only that you're not being productive, but everyone who's employed under you, your MAs,
Mm-hmm.
the janitors who come in and clean your place, like
Mm-hmm.
everyone is affected. Like, and so it's a great responsibility to be in private practice, really.
Yeah.
I think so. You're putting, your practice is putting food on the table for a lot of people and paying for their kids'
Yeah.
education and retirement and all those things,
Mm-hmm.
right? Like in their college funds,
Their
like,
everyday
so it's
activities. Yeah.
exactly. So it's a lot of responsibility, and just sitting down and being with people who have been in it now for, I believe, 20 plus years,
Mm-hmm.
and talking to them and their struggles and how they had to build the practice, and things that they wish they would have done differently. It was just such a really good knowledge. It was like sitting around
Yeah.
and just been like in awe, like, oh wow, like this is really, like so many notes. It was great.
Yeah. I don't think we're talking about this necessarily to advocate one as being better
No, no, no,
than
no.
another. And definitely each type of practice of medicine, whether it be academic or private practice, they're both necessary, especially in
Yeah.
the United States. We went through academic centers to get our training. Without them, we wouldn't be training. We wouldn't be doing what we're doing. And I had some
Right.
fantastic mentors who helped me get through that. And definitely, even in residency, we had some of those mentors give lectures on the differences between academic, private practice, multi-specialty groups. And it comes down to a personal decision to what's important to you. A lot of the time, you can have a lot more flexibility with small practices because you have a lot less overhead and a lot less
Yeah.
administration telling you things and protocols that need to be set up for larger corporations. And the fact of the matter is, smaller private practices, you don't have to go through all those layers of protocols most of the time. That doesn't mean
Yeah.
you're not practicing good medicine. It just means that you're in a different corporation who may have a little more flexibility there. At the same time, you work for private practice, you might not have the stability of working for a huge entity who's been around for 100 years, like Loma Linda
Yeah.
and like UC Davis. I mean, like these huge academic centers, that have a lot of backing and a lot of monetary backing, that you're not thinking that another pandemic comes along and you aren't able to see patients and you're worried that you're going to be able to put food on the table type of thing. So these, I'm not advocating one's better than the other, but it comes down to a real personal decision. And for anybody who's in medical school listening to this or thinking about going into medicine, it's something that should be considered before you start looking for jobs, because by then you missed out on a lot of time where you could have been doing some research, talking to people around and doing all that sort of stuff. And I think that I could have done a better job asking around about that sort of stuff, even though I think that I did at the end of my training get a lot of good advice.
Yeah. And I think the big thing is you kind of hit on the head a little bit, is like, you kind of feel like, oh, I shouldn't talk about this. You know, the business side thing is the hush hush thing. It's a reality. We're all adults. How much do you make? What are your risks? What are your tail coverage? All those things, like those are things that you need to be asking because you need to be informed. And I know it's like hard because you're drowning in so much medical knowledge and work, but I think that's what made this experience so great, is that, I have an offer for a job after my fellowship, and they just asked me a bunch of questions. It gave me so much insight. And they're like, hey, you need to think about this. You need to think about that. Have you thought about this? And I was just like, no, I haven't, because again, I just feel like I'm a 5-year-old, like, oh, I don't know what I'm doing, but like, I know so much. It's yeah, it was a really good experience. And so that took up a lot of my time. And then, kind of moving forward, I'm almost done. I'm 54 days from being done with my residency. And right now, I'm getting ready for my grand rounds, which I'm looking forward to. I put in a lot of time and effort towards it. And so that's something that, I really am ready to just present and get done. And so, yeah.
For those listening, most of the people listening to this, I'm assuming they know what grand rounds is, but if you want to maybe describe what goes into preparing for that, when you first got to experience a grand rounds for the first time, and maybe pros and cons of maybe getting rid of the archaic grand rounds. I don't know.
Sure. So grand rounds at an academic center is a department round, which means that or a department lecture, which means that everyone in your the UC Davis Department of Orthopedics will be there, right? So everyone's going to be there. And then there's actually, we invite local surgeons in the community to be there too. And we invite people from, internationally or from other places, or, just our local professors or attendings to give a lecture on a topic that they decide. And it's usually a 40-minute lecture that gives about 20 minutes for discussion afterwards. 40 to 50-minute lecture. And it's really hard to talk about something for 40 to 50 minutes.
Yeah.
And so your job is to, one, pick a topic that you are interested in or really would like to know more about, because you learn a lot through it. And then two, to present the history, how you work up the disorder. So for mine, it's femoral acetabular impingement, which is a disease of the hip. And so the history of that, how it presents, how we treat it. And then the big thing is what does the data show? So we live in a world of evidence-based medicine. And so when we're talking about this disease pathology, what is the newest information that's coming out? Tell us about how to treat patients with this disease. And what are their outcomes, and how do we inform patients about, hey, you have this issue with your hip. Do you need another surgery? What risk factors do you have for that next surgery? What risk factors do you have that this surgery isn't going to do as well? So maybe we should do this surgery. And it's to inform the populace about that, and to answer questions. And they're critical and critique questions. But it's meant to, it's almost meant to stir the pot and to inform, because there's going to be a lot of people who have a dogma of this, and they're going to say, well, what about this and this? And you're going to say, well, this is what I've read. This is what the data shows. So therefore I feel this way. I understand where you're coming from. Maybe we can do more studies in this realm. Right. So, it took me probably about 3.5 weeks to complete the PowerPoint and read about 40 pieces of literature.
Yeah.
Now it's like kind of in that final phase of just making sure that everything runs smoothly and I can talk for 40. Talking for 40 minutes is really it's really
Yeah.
challenging about a
Yeah.
topic, and keeping people engaged too. So
Yeah.
yeah,
How often do you guys have ground rounds?
every Tuesday.
Every Tuesday.
So
I think I came at it a little bit harsh at the beginning by calling it archaic. It is one of those things that has stuck around, especially in like internal medicine, where people will go to grand rounds and they'll present a case. And there's certain people who like to go there and basically just banter and kind of stir the pot. And from my experience, like interacting with different grand rounds since medical school, some are a little more useful than others. I'm sure yours is going to be very useful, but kind of giving a little context to my little harsh assumption of calling it archaic and whether or not
well,
to
I
get
mean,
rid of it.
I mean, hip arthroscopy has only been around for less than 28 years in the population, and it's grown almost logistically since then about the indications and what we could treat for it. So when you're speaking to an older cohort of surgeons, they are going to have dogmas. So it's like I'm really preparing my way for how to answer their questions, because I know what questions they're going to ask. But it's something you have to put a lot of time and effort into. And on top of that, and studying for boards, it's been pretty busy.
I remember that.
So but it's good. So I'm getting ready. Like I said, 54 days left.
Yeah, it's an important part of residency training for sure. Just making sure that you're always going to have the ability to back up your thought process with data and reasons why you do things, instead of just saying, well, we do it because that's the way we do it. That's just not going to fly in a society like today's, with so much ease of access to information. We got to hold ourselves to a higher standard, which you do, and that's awesome.
Yeah, and I mean, it's one thing if you're been practicing for 30 years and you're like, hey, I do this because I see this in my patients. Like, oh, you have 30 years to back that? Okay, great. Like,
true.
When you're a chief resident and you're saying, well, I like doing this, and someone says, well, why? And you're like, because I like it. Nah, that's not gonna fly. How do you feel about Twitter?
Well, Elon,
native of Austin, Texas now, by the way.
Yeah, took a small $44 billion lump sum of money and purchased one of the most influential social media platforms in the world, Twitter. And I mean, the rumors are he's going to move the headquarters over here to Austin, which is going to drive the housing market up even more, because it's not like we have Google, Apple, Samsung, Dell all within a 2-mile radius of me right now. But yeah, it's really cool. Tesla's actually outside of town, out by the airport a little bit, but I don't know where the headquarters of Twitter is. I hope
probably
that
San Francisco.
And I think his ideals regarding what he wants to make, turn it into, I should say, are good. I mean, free speech should be free speech, no matter what side you're coming from. Because if we don't have dialogue and we don't have people who think differently, and we're just a culture of people who have just a one-track mind and nobody has any differences, I mean, we're not going to progress as a society. And I think he's got good ideas for it. And I'm actually happy about it. I think it's interesting and fascinating, and I'm going to be definitely checking out what it turns into.
Yeah, I mean, I think I had Twitter for all of 2 weeks, and then I was like, I'm out of here. Like, this is just a giant echo chamber, of people, and reports that I read from more conservative sites, of course, state about shadow banning and that things are being released because of political reasons and so on and so. And I agree with I'm happy about him taking over, and I hope he just sheds lights and has transparency. And so I mean, the thing that I see is that, like, people are upset because they're saying he's always been rich, he's always been that, and this is a very successful person, right? Like, that's who he is. Like, for you to just say all these things, but what he's saying, at least personally, is that I just want more transparency and I want freedom of speech. I think it's a great thing in a democracy and in a free society. And for people to be like, this is the end of formal civilization and all these like, things. It's like, whoa, like guys, come on. Like just, so I'm interested to see how it works. And
Yeah,
I really hope he's transparent. And, I hope that um he seems like someone who would hold himself accountable and others accountable.
sure.
And so we'll see. But yeah, it's been super interesting. But my rule of thumb is if a news story breaks, wait about 2 to 3 days and then you'll get the truth.
It's true. I mean, you think about just primary resources, how many, I mean, unless you're there witnessing it firsthand, like how many of us are actually appraising the the reliability of the news sources that we're ingesting, whether it be social media, whether it be, I mean, like mainstream news media, all that stuff. I think appraising things is definitely more difficult than people make it out to be.
Yeah. Yeah. So, but the big thing is that if there's algorithms where certain things aren't being shared because of the way that they lean politically or things of that nature, like, it's a free and public square where you're able to say things that, as long as they don't call for actual violence and hate, like actual violence and hate. If you just don't disagree with it, then, or if you disagree with it, then that's okay. Like
Sure.
you just disagree with it.
Yeah.
But to just say this needs to be blocked or set aside or it's not shown to people because I don't like the way it looks. I'm sorry, but I really don't care about your feelings. I
Yeah.
care about my family's feelings. I care about my wife's feelings. I care about my future children's feelings. I care about my good friends' feelings. I don't care about your feelings, really.
Yeah, I hear you.
So it'll be
It's
interesting.
interesting. He's a very eccentric individual to own something like that. So I think it's going to
Yeah,
be those type
but
of
we'll see. I
successful
mean,
people. I mean, people be like, oh, there's nothing special about him. They're the most successful people are probably the most interesting people because like they're willing to do the things that a lot of us aren't willing to do as far as risk and putting yourselves out there.
for sure.
Yeah.
Yeah.
So are you catching any of the NBA playoffs?
A little bit here and there.
Yeah.
I try to make it to a couple places to watch the games or turn it
Yeah.
on TV, but I'm so deep in boards right now. It's like my boards are until July, but I know it's May 1st, but
Yeah. You're regimented.
just preparing for it now. And you gotta do it now or else it'll be too late.
For sure, man. Well, I'm happy we can spend this time together and
Yeah,
have a nice chat and talk about some things that'll get our mind moving a little bit and thinking because that's what it's all about. Yeah, I'm enjoying watching the Bucks play. Giannis is an absolute beast of
freak.
a player. I actually didn't get to watch the NFL draft, and I didn't even follow much about the Packers. So I guess some people are gonna be calling me out as a fake fan now. So but I've been watching the Bucks play some good games. Cynthia's been following the Mavericks. I didn't realize I was married to such a NBA fan, but it's kind of exciting seeing her get all pumped again. I remember when we were in college when the Mavs won the championship back then. She got super hyped. We went to the parade and everything like that. But it's nice to get into it as a couple.
Oh man, Cynthia she'll come at you now. She'll talk some trash.
Yes, she does. Oh, she's always done that. She's always done that.
She's feisty.
Yeah. Oh man, but yeah, the Bucks just won the first game of the Celtics series today. So beat the Celtics in Boston, and Celtics have a good team this year too. So not many people gave them a shot at winning the series or especially this game today. So I think they play a little better as the underdogs. So I was excited to watch that.
Yeah, Megan's down at Stagecoach right now, which is a big country concert. So basically, it's like Coachella, and then as soon as Coachella is done, it turns into Stagecoach.
Yeah.
But tonight is the
everyone
night
just puts on different type of cowboy hats.
Seriously. But she goes with a big group of friends, and it looks like a great time. But this was my last call weekend of residency, so no
congratulations.
call weekends.
Oh man.
Yeah,
let's give this a slow clap right here. Last call weekend of residency, Dr. Zachary.
Yeah. So
congratulations.
Did a fix the humerus and fix the femur, and had a couple calls overnight from our in-house resident, and came in this morning and had a nice breakfast with a friend and a colleague, and yeah, it's good. I'm off now, and that's definitely a good feeling. But yeah, tonight is Luke Combs, which I would love to go see Luke Combs. I'm so jealous
Oh
that she's
man.
down there tonight. Like last night was Carrie Underwood, which that would have
Oh
been
yeah.
great, but like Luke Combs, I've been like, oh gosh, all of his music I love. So she's having a blast, and
Yeah.
I missed her. I've probably seen her a grand total awake 4 hours this week.
Really?
It's been
Okay.
pretty crummy. And
Gotcha.
my dog's in my Jasper's in doggy daycare because I've been on call, and then she's not coming home until late
Oh,
tomorrow, and I have work, and so it's like been pretty
it's
lonely here
quiet
for
around the
sure.
house. Oh
It's
man.
very quiet.
Luckily I can yell in your ear for a couple minutes tonight.
Yeah, well, a lot of studying for boards has gotten done, so that's good. So I guess there's a positive out of it. You got to turn every negative into a positive.
I like it. I like it. Well, May's off to a good start. Cynthia and I are continuing to look for houses to potentially purchase.
How's that?
Ooh,
We're selling. We are selling, and we're gonna make. It's kind of we're like, hey, do we do because we're not going to put the house on the market till August, and I'm like,
yeah,
oh, do we do it sooner? The Fed's putting interest rates up, and
yeah,
inflation's going up, and
yeah.
so
It's slowing
you
down
know
a tiny bit around Austin, but with all these companies coming in, it's more of a temporary thing or temporary plateauing. If anything, it's going to just continue to go up.
yeah.
Yeah, but we're not rushing everything. We're making sure we're praying about it a lot, making sure we're making the right decision and finding the right place that we're looking into long term. And it's good. Yeah.
Yeah, for little Gus.
Oh, eventually, you know it.
Yeah, I
For my
just found
mom,
out
for
one
my
of
mom,
my
if she's listening, it'll happen eventually. Don't worry.
yeah, one of my colleagues was like, hey, I'm going to Big Sur, and he was like, making a big deal out of it. And I did, hindsight's 2020 now, but they just announced they're pregnant, and
Oh,
so I'm like, oh man, that's awesome. And then one of my other colleagues, who's 2 years behind me, just had twins.
yeah,
So he had his week of paternity leave, and now he's coming back, and
yeah.
so looking forward to talking to him. And
It's a whole new
I
world,
was
whole new
yeah,
world for him.
I was actually the first one to go see his twins, so I'm pretty
Yeah.
stoked about that. I didn't even know it. I was like, "Has anyone come to see your babies?" He's like, "No." I was like, "Yes, dibs, dibs."
Oh man,
I was
I love it.
I'm about to make a code rainbow in this piece right now. Take one of these babies out of here. He's like, "They got low jack on," and I was like, "Oh, okay, never mind then."
Oh man. Well, what else you got? I think I'm all tapped out for this reunion that we've had tonight
It
because
seems like a
this
reunion. We need to
I
make it more. As soon as I'm done with all my like end of year grand rounds and things like that, I'll be a little bit more available. But right now, it's like,
you're good,
oh,
man.
it's crazy.
Yeah, I respect your time and I appreciate you always getting on here.
Hey,
It's
Peter, I
studying for boards
appreciate
is
I appreciate you so
well,
much.
listen to these people. These people have to listen to us talk to each other like this. How many people are vomiting? Like just this
Couple,
why
pretty a couple. The people who know us definitely are
yeah.
vomiting.
All right, well, we'll sign off then. If we got nothing else to bring up, it was a good conversation. Academic medicine, private practice, your elective experience. I like to hear about it.
The
And
Bucks won one game so
yeah,
far.
well, they won the series against the Bulls, but the Bulls were a little shorthanded. So
Yeah.
all right. Well, thanks for joining us, you guys. This is the Skin and Bones podcast. We're signing off. Dr. Peter Gust and Dr. Zachary Hill, just two guys hanging out and just trying to live a normal life. So you guys have a great
Expones,
rest of your
baby.
day. All right.